All right, so here we are. I wanted to talk about a video I took the other day. I had a patient who came in for a procedure, a corrective surgery. He had the work done by the Artas machine. The Artas machine is a robotic machine that removes the follicular units from the back of the head. So it's a follicular unit extraction method of transplant. The patient went in for a 2-day procedure. He had 2 separate days of anesthesia. They harvested 1,700 follicular unit extraction sites. Now, when I made the video, I left out some very important details that I wanted to go into detail with. So I'm going to film on top of my previous filming. This is the case. Here's the patient. And one of the things that I really didn't address was how they harvest the donor is not within what is called the safe zone. The safe zone is an area in the back of the head where it shouldn't fall out genetically. We all see these bald guys around town where they have that ring of hair around the back of their head. We want to stay as much in the center of that ring as we can in order to make sure the grafts that we move are stabilized hairs that won't fall out in the future. So when they do the Artas machine and they're pulling out a huge number of grafts, which is 1,700, which is more than they're supposed to with that machine, they have to go in a bigger area, and that area could be susceptible to falling out later on due to genetic factors. The other thing that I want to talk about, I'm going to play the video and we'll kind of talk as we go here. Artas robot machine doing his procedure about a year ago. He was looking for a lower frontal hairline and to restore his temples. He did a 1,700 follicular extraction Artas case, and unfortunately he was not happy with his results.
2-day procedure.
The procedure took 2 days to get him the result that he wasn't looking for. I want the camera to take a close look at the follicular extraction area. What happens is when the robot takes the follicular units out, it's punching out little. Okay, I'm going to pause this. Each one of these white holes, those are holes now, that is scar tissue from where the machine pulls the follicles out. So what you're seeing are this new scar tissue, okay? So what happens is, due to these punching, the way the machine punches or the way a punch biopsy works, is it's punching a hole out. When a hole is punched out, it affects the nerve supply, it affects the blood supply. You now have multiple polka dot holes that are not scarless, which are actually causing more scarring than you would get from a linear procedure. More importantly, this donor is now depleted. If you were to go back for another Artas robot machine procedure, what's going to happen? They're going to poke these holes next to existing holes, and they're going to make bigger scars. So you're going to have a completely scarred up back of your head. When he comes to me for correction, which he did, I see quite a deal of corrective surgery cases with the robot and the neograft and all these cases. What I have to do is I have to pull a strip out of this area, but now each of those holes are taken from where I'm getting viable tissue. If I go too wide, it closes under more tension. Also, this blood supply is now affected underneath due to those multiple punches. So this latest, greatest, best procedure that's out there is not what it's being sold as. They say it's scarless. Here you go. It's not scarless. You have more scars than you would with a linear procedure. They say you're going to get more hair. Not true.
he got 1,700 follicular units. If those were all perfect, I mean, I'm talking, they were on his best day, you're talking that might at best get you about 4,000 hairs. When I do a regular strip surgery and just do a basic max harvest for 30 square centimeters, that's going to yield you minimum 6,000 hairs. And that's done in 4 hours with much less scarring. What's happening is that a lot of my patients have even more elasticity where I can get them more than 30 square centimeters. I've been pulling out cases consistently, 60 square, 70 square centimeter cases, where I'm able to cover their entire top of their scalp from front to back. Whereas with their biggest 2-day case, they might only cover the frontal region or just one area. And then they're depleting your donor and causing more scarring. And so
each little area that it punches out, it tries to get a perfect follicular unit. What happens is unfortunately it does not get a perfect follicular unit. It destroys the follicles, and then in return leaves a scarred area void of hair. So when I do my next procedure, unfortunately it affects the amount of donor area I'm to get due to the previous punch biopsy extraction by the Artas machine.
So, in conclusion, the follicular unit extraction should only be used for very, very small areas, if it's to be used at all. I strongly encourage my patients to do some serious research. It's not scarless, it's not painless. Those are misnomers. You get scars, and every patient who has it tells me it's way more pain than they've ever experienced. And those are patients coming from other transplant procedures. So don't be misled. Do your research. Understand what you're going to get is areas that have more scars with polka dot holes all over the back of your head, and don't fall for the hype. Josh?
You want to address the aspect besides the removal of the donor? How about the artistic part of his hairline, of which he was 22 years old and they gave him a hairline that would be appropriate for a 50-year-old man?
Okay, so you're saying because they've taken out a smaller piece, they had to put the hairline higher?
Well, I think from my conversations with people every day on the phone, and they all buy into their marketing, where they're saying that this is the latest, greatest advanced method out there, and the strip method is old, antiquated. They show an example of worst case scenario of someone who went to a bad doctor and has a big nasty scar. They wouldn't show your examples of your work because it wouldn't make their case. But what people don't realize is that all that extraction is just one aspect of many for a procedure.
Okay.
So they're not considering the artistry of the doctor.
Okay.
They're not considering his ability, talent, his experience. The reality, as we know, because we're in this business, a lot of people are buying a machine because they're able to buy a machine. The people who sell the machine say, "Hey, doc, you want to get in the hair transplant business?
Okay.
Buy our machine." And you're having people who don't have what you have.
Okay. What Josh is explaining is that the machines are being sold to doctors that aren't hair transplant physicians. So because the hair transplantation is a pricey procedure, doctors see it as a good way to make extra revenue for their practice. So many doctors who aren't hair transplant specialists are being sold these machines, whether it's a neograft machine or the robot, and they say, okay, well now you can do a hair transplant because this is going to take the donor hair off for you. And what Josh is making a very strong point of is that is one minute aspect of a transplant. The most important part of the transplant is the artistry, making your hairline look natural, making it fit the patient's face, being able to detect what's going to happen in the future for the patient as far as future hair loss. There's so many facets that determine how your results are going to be, starting from the artistry, ending with the staff that helps to put your grafts in. And so if you don't have a surgical staff that's trained in transplantation, if you don't have a doctor with a keen eye for artistry, you are going to be in my office for corrective surgery. And that is what I am seeing. A lot of poor results out there, unfortunately, and it's not the consumer's fault. They're being misled and told that all doctors are equal, when in fact in hair transplantation, you have a better chance of getting a bad hair transplant than you do of getting a great hair transplant.
And also what I try to stress to potential patients is for them to identify what they're looking at when they look at a doctor's website. Do you see many examples of the work? We have over 260 videos on our website. What does that compare to the doctor you're choosing? A lot of times when they buy the machine, they get a company video. It's not the doctor's work. And what they're showing on the video is a very limited type of patient. They're showing a guy with wet hair who has a lot of hair, and they're making him look worse. And the reality is they can't do a whole lot, if anything, for certain types of people. African Americans with curly hair should not have the procedure, but yet they're being sold the procedure. So,
okay, so exactly what Josh is saying is the doctors that are purchasing the equipment to boost their practice revenue are getting stock photos from the company to display as their work, when in fact they are not the doctors that do the work. Big companies that are out there, I won't mention names, when they show you the work, that's not the doctor you're going to get. They're showing you their best work out of the entire company. But is that the specific doctor you're going to get's work? That's what Josh is alluding to, basically saying, be careful when you talk to a doctor, make sure the work that he's showing you is in fact his own work, and that he's able to produce what he's able to show you. In conclusion, be wary, do your homework, don't go just based on what they're telling you. Get the facts, get the proof of their work, and then make an informed decision.